Once again, my presentation will be on prevalence and factors affecting the use of traditional medicine in my country, Brunei Darussalam. I must acknowledge my co-researcher, Zoin, and also Linda, who is a pharmacist at the Ministry of Health. Zoin is an epidemiologist, and few of recruited research assistants that we have employed during conducting this study. Right, if I bring you to where we are now, we are in Hyderabad, and where we are located, Brunei is one of the Southeast Asian countries. We are one of the ASEAN countries, surrounded by East Malaysia. It's located in the Borneo Island, so as you can guess, we are still covered with 70% of forests, rainforest. So that's the flag of Brunei, and the capital city is Bandar Seri Begawan. So we are still a small country. Our population is only 400,000. So I would like to promote more on Brunei. So you are most welcome to come to my country. It is still covered by the rainforest, and we are a Muslim country, so you will see a lot of mosques. And we have been known as the Venice of the East. We still have that water village, people living in the water village. So moving on, back to my presentation. The study that we did is on, it's a survey study that we conducted for the whole country. So the overview of my presentation will be introduction, aim, method, outcome of the study, summary and discussion, and also conclusion. So as an introduction, the use of traditional medicine and complementary alternative medicine are common in ASEAN countries, including Brunei. My colleague from the Ministry of Health, Dr. Chong, did a study on the prevalence and predictive factors on CAM, complementary alternative medicine in Brunei, that has been published. But our group wanted to know about the traditional medicine. Yeah. So this is a cross-sectional study where we assess the prevalence of traditional medicine use among Bruneian, which will include the predictive factors, perceptions, and also attitudes and practice of traditional medicine. So WHO has defined traditional medicine as diverse health practices, approach, knowledge, and belief incorporating plant, animal, and or mineral-based medicine, including spiritual therapies, manual technique, and exercise, which applied singularly or combination to maintain well-being as well as to treat, diagnose, or prevent illness. We have put all this definition to our participant of the survey, so that they understand what is traditional medicine as defined by WHO. Whereas complementary alternative medicine refer to a broad set of healthcare practices that are not part of the country's own tradition and are not integrated into the dominant healthcare system. Right, this is I reference this from a meeting that's been through in Manila in 2001, where they have elaborated the TM, traditional medicine use in Western Pacific region. And as you can see, it's quite common in most countries. So the type of traditional medicine that are used in Brunei are divided into 4 types that I've put. Malay Ubat Kampung, that's mostly like from the traditional old folks belief, where I guess it's also similar like Indian herbals, where they use roots and decoction, where they boil the roots and also drink the preparation for example, for well-being after giving birth, for example, yeah. And traditional Chinese medicine are coming from herbs and medicinal plants. Indonesian jamu, as you can see, our geographical location, we are more influenced towards the there's some influence from Indonesia, so some Indonesian jamu are well used as well in Brunei, and Indian herbals as well, Ayurveda. So we have classified this in our study. So first and foremost, the aim of our study is to investigate the extent of TM used in Brunei and to study the Bruneians' perceptions, attitude, knowledge and practices on the use of TM and to compare the practices on the use of TM with conventional medicine. Are they using conventional medicine, so like for hypertension or diabetic? So diabetes, I mean. So they are patients are still doing that, yeah, and to address the cost implication with the use of traditional medicine. So our study was done back in 2007 and 2008 for a year. As I mentioned earlier, we employed 3 research assistants and we trained them. So they go to this Brunei is divided into 4 districts. So this is a map of Brunei. So as you can see, the main district which are most populated is the Bandar Cervical. So this is where we did the study at the hospital and also health centers. Temburong is least populated. We also did it in the remote area and also in the remote area of Tutong and also remote area of the other district, which is Kuala Belait and Seria. The methodology, there are around 2,400 respondents respond to our survey questionnaire. Although it's random sampling and we analyze it using SPSS version 16 for data management and analysis with the help of a statistician. The questionnaire are by interview. We modify it from the pilot study and then we train our researcher to question the participants. It's a semi-structured questionnaire including open-ended question. We inform consent is obtained and it consists of 27 item questionnaires. The questions consist of Malay and also English. Malay is the mother tongue language of Brunei. So demographic characterization of the respondents. Most of them are at the age of 37% at the age of 18 to 30, the red colored coded, yeah. Whereas 7% are from the range of 31 to 45. So I would say the participants of the study are quite from a young age, yeah. And most of them are female, 68% of them. So I guess female respond more to questionnaire. I don't know why. Status of respondent, most of them are employed with the government. As you can see, we are a country run by the government. So most of our population are also employed by the government and less from the private sectors. And ethnicity, we have various ethnic group in Brunei. Mainly 85% are Malay and then 15% are Chinese. So this is relates, this questionnaire, the result relates to the Brunei population. When we ask about the knowledge, surprisingly, traditional medicine, 24% would answer that they take together with conventional medicine. Although I will reveal later, some of them would not declare it to their doctors, which is interesting, which I believe in the presentation of our key plenary speakers will have revealed that. So it's not surprising, it's similar pattern. And 35% conventional medicines are better than traditional medicines. That's their knowledge, okay? And the other complementary therapy that they've tried is massage. As outcome of the study, I'll try to finish as soon as possible. 59% would say yes, they responded to traditional medicine. And in terms of ethnic group, there's similarity between Malay and Chinese. And interestingly, when we categorize it, above 56 years old patient or participants are of that age. Different ethnic group and gender, we clarified it. The blue bar is where female, and as you can see, it's again Malay. And most of them are taking local herbs. So these are like, as I mentioned earlier, preparation for losing weight for after maternity, yeah. And then when do they use traditional medicine? Most of them say it's more than a year ago, but 42% say less than a year. And duration of traditional medicine use, 38% are taking it daily. And why do they use it? Because for general health and vitality. And most of them perceive that traditional medicine are safe. Again, this is similar pattern that we can see elsewhere. Why is it safe? Because it has been traditionally practiced over the decades. And they claim that there's no side effect with using traditional medicine. They use conventional medicine, and as I mentioned earlier, 73% would say no, they wouldn't report it to the doctor. So that's interesting. And how do they use it? They took it together, but then at a different time. They say it's easily available, and the source of traditional medicine are from traditional and spiritual healer, and also from specialized shops. So average cost is below $10. That's like 7 US. So in summary, I summarize it that. I won't elaborate more because I lack of time now and discussion, but there'll be more picture. I acknowledge my colleague and my reference. That's our new building of the university. And these are more picture of Brunei. Please welcome to Brunei. Thank you very much.
Any questions?
A good presentation. I'm very stimulated by your proactive nature that you are working on this. I also want to mention that this is the second time I'm hearing. Remember, the women are now the leading force of the society. Men are getting lazy. They always sleep too much, don't do too much work. Women leading the world now. So you have shown that. As well as I saw in Warsaw, Poland last month, only that the women are less hypertensive because they take better care of the health. So my question is, it is quite common, even in US, my patient tell me they use herbal medicine and vitamin supplement, this and that. So I think it is true that many people, patient, they use supplement, but they don't tell their doctor they are doing it. You know,
Yes.
so I think it is important for you to look into really very critically that whether this mixed traditional medicine and herbal medicine are complementing each other. So that could be a plus for the herbal medicine.
Thank you for the comment. Thank you.
Any
We'll take
more
it up.
questions?
We will also be communicating with the Ministry of Health to inform them about our research study, outcome of this study.
Yeah, I have a question. Here.
Hi.
Yeah. In the selection of your population for the study, you had grouped one which was 18 to 30 and the other in the 50 plus group, the age
Yes,
group.
yes.
So what was the data looking like? The use of medicine was more in the senior citizen group, or
Senior citizen, 56 years and above, 71% of that
Versus?
survey participant.
okay, versus the anything in the pediatric range?
Pediatric, I have to go back. No, because I believe we only interviewed
18
above
plus maybe.
16
Okay,
to 85 years old, so no data on pediatric. I'm sorry.
okay.
Thanks a lot. Yeah. Any more questions?
It's not a question, but a general observation. The earlier speaker, Dr. Mandal, and everyone is heavily stressing the point that the people who take alternative medicine or other form of medicine, they don't report to their doctors. But the question is, even if they report to doctor, whether doctor will understand that. And mostly because he doesn't understand it, he will discourage them to take it.
I agree with that. I think that's what the fear of the patient, that the most doctor would not agree. I tell them that I really don't know about this, so I think that's a negative impact on the part of our right. That's why they don't report.
Thanks a lot for that.
I may add to this comment. I think it's a question of educating the masses, at the same time educating the pharmacists and educating the doctors. In Canada, for example, the use of herbals is very frequent, and the side effects which have been appearing, they have been reported in the press, and the doctors have been worried about it. So now, when a patient goes to a doctor, one of the questions the doctor does ask the patient is, are you taking any supplements? What kind of supplements? When the patient takes the prescription to the pharmacy, the pharmacist, after dispensing the prescription, does ask, are you taking any herbals or traditional Chinese medicine? If so, then they have a good bank of interactive drug results, and they will say, no, don't take grapefruit juice with this. Don't take garlic with this. Don't take ginger with this. So they give a good classification of what is to be taken, what is not to be taken with the dispensed medication. So it is a question of mass teaching, mass
Awareness.
dispersal of the facts.
Thanks a lot. Thanks a lot. Any more questions? Thanks. We request our chair members to present the certificate.
Thank you so much, Dr. Nurolaini. Please collect your certificate from our chair and co-chair. Very, very informative presentation, I'm sure. Thank you.